I'm Lee Schwartzberg, Chief of Hematology and Oncology at Renown Health Pennington Cancer Institute in Reno, Nevada. This year I'm talking about the updates for the 2024 breast cancer abstracts from ASCO. In early breast cancer, I think the most important and impactful presentation was the ECOG trial that looked at what taxane is better for Black patients. And that was based on a lot of data actually from previous trials that showed that Black patients were more likely to get peripheral neuropathy from taxanes. And it was tested prospectively in an ECOG trial. They also looked at genotyping, which was the primary endpoint of the trial, which actually was not really informative. But they also looked at whether or not paclitaxel or docetaxel caused more peripheral neuropathy and stratified by race. And it did turn out that Black patients who got paclitaxel had more peripheral neuropathy, including more severe and lengthy peripheral neuropathy. Based on that, my takeaway is that I will use docetaxel, the taxane that was less causative for peripheral neuropathy, in the adjuvant setting for Black patients preferentially. In the metastatic setting, I think the most impactful presentation was Destiny Breast 06, which looked at trastuzumab deruxtecan versus treatment of physician's choice in HR-positive, HER2-negative breast cancer for patients who had previously been treated with endocrine therapy, which is the standard for those patients. What this study showed was that TDXD was better in terms of progression-free survival compared to standard chemotherapy in the first-line setting. The other important thing about this trial is that this study expanded the population that could be eligible from those that are HER2 low, previously defined as 1 or 2 plus IHC positive, to include a new group called ultra low, which was a group that had some immunohistochemistry staining on their tissue, but less than one would see by the standard definition of 1 plus IHC. And again, for this now larger population and in the first line setting, this is a new possibility for our patients who require chemotherapy after endocrine therapy in the metastatic setting.